Question 1. The audit findings indicate that a recent program evaluation report presented a p-value of 0.03 for the primary outcome measure, concluding that the intervention was effective. However, the report did not include a confidence interval for the effect size. Considering the principles of inferential statistics and best practices in public health reporting, which of the following represents the most appropriate interpretation and subsequent action? Option A. The report should be revised to include a confidence interval for the effect size, which will provide a more complete picture of the intervention's potential impact and its precision, allowing for a more nuanced interpretation beyond simple statistical significance. Option B. The statistical findings should be disregarded due to the absence of a confidence interval, as the p-value alone is insufficient to draw any meaningful conclusions about the intervention's effectiveness. Option C. The conclusion of intervention effectiveness should be accepted as valid, as a p-value below 0.05 is sufficient evidence to declare a statistically significant effect. Option D. The program should be immediately scaled up based on the statistically significant finding, as further statistical analysis is unnecessary when a p-value indicates a significant result. Correct answer is A. The report should be revised to include a confidence interval for the effect size, which will provide a more complete picture of the intervention's potential impact and its precision, allowing for a more nuanced interpretation beyond simple statistical significance. Explanation. The audit findings indicate a potential misinterpretation of statistical evidence, which is a common challenge in public health surveillance and program evaluation. Epidemiologists are tasked with translating complex data into actionable insights, and the appropriate use of inferential statistics is crucial for making sound public health decisions. The challenge lies in moving beyond raw data to draw valid conclusions about populations and interventions, while adhering to rigorous scientific and ethical standards. The correct approach, which involves constructing a confidence interval to estimate the plausible range of the true effect size, represents best professional practice because it acknowledges the inherent uncertainty in sample data. This method provides a more nuanced understanding than a simple hypothesis test by quantifying the precision of the estimate. It aligns with the ethical imperative to communicate findings accurately and transparently, avoiding overstatement or understatement of evidence. Regulatory frameworks, such as those guiding evidence-based public health policy, implicitly require this level of statistical rigor to ensure that decisions are informed by reliable estimates of effect and their associated uncertainty. An incorrect approach that relies solely on a p-value from a hypothesis test without considering the confidence interval fails to fully characterize the evidence. This can lead to misinterpretations, such as declaring a statistically significant result as practically important without understanding the magnitude or precision of the effect. This is a regulatory failure because it can result in the misallocation of resources or the implementation of ineffective interventions based on an incomplete understanding of the data. Another incorrect approach, which might involve ignoring the statistical findings altogether due to a lack of statistical understanding, represents a failure to uphold professional responsibilities. This can lead to missed opportunities for public health improvement and a lack of accountability in program evaluation. A third incorrect approach, which might involve selectively reporting only the statistically significant findings while omitting non-significant ones, is a clear ethical and regulatory failure, as it constitutes data manipulation and misrepresentation, undermining the integrity of scientific evidence and public trust. Professionals should employ a decision-making framework that prioritizes a comprehensive understanding of statistical results. This involves first conducting hypothesis testing to assess the likelihood of observing the data under the null hypothesis. However, this should be immediately followed by the calculation and interpretation of a confidence interval to estimate the magnitude and precision of the effect. This dual approach allows for a more robust assessment of the evidence, enabling informed decisions about public health interventions and policy. Transparency in reporting both the hypothesis test results and the confidence interval is paramount. Question 2. Benchmark analysis indicates that understanding the historical trajectory of epidemiological methods is vital for contemporary practice. Considering the evolution of public health surveillance and research within the United States, which of the following approaches best reflects the integration of historical epidemiological principles with current U.S. regulatory and ethical standards for handling sensitive health information? Option A. prioritizing the application of foundational epidemiological study designs and data collection techniques as originally conceived, irrespective of subsequent changes in data privacy legislation. Option B, emphasizing the historical development of disease mapping and outbreak investigation techniques, while ensuring all data handling and reporting strictly adhere to current U.S. federal regulations, including HIPAA and the Common Rule, and incorporate modern principles of informed consent and data de-identification. Option C, focusing exclusively on the theoretical underpinnings of early epidemiological theories, such as miasma theory, without direct consideration of their practical application, or the regulatory environment of modern public health data management. Option D, advocating for the readoption of historical public health data collection methods that were less constrained by individual privacy concerns, arguing for their efficiency in large-scale disease tracking. The correct answer is A, prioritizing the application of foundational epidemiological study designs and data collection techniques as originally conceived, irrespective of subsequent changes in data privacy legislation. Explanation: this scenario presents a professional challenge because it requires an epidemiologist to navigate the historical evolution of their field while adhering to the specific regulatory and ethical frameworks governing public health practice within the United States, as implicitly required by the American College of Epidemiology ACE Fellowship exams jurisdiction. The challenge lies in distinguishing between foundational epidemiological principles that have stood the test of time and those that have been superseded or refined by modern understanding and legal mandates, particularly concerning data privacy and research ethics. A deep understanding of this evolution is crucial for responsible practice. The correct approach represents best professional practice because it acknowledges the historical context of epidemiological inquiry while grounding current actions in contemporary U.S. regulatory requirements, such as those established by the Department of Health and Human Services, HHS, and the Health Insurance Portability and Accountability Act, HIPAA. This approach prioritizes patient confidentiality, informed consent, and ethical data handling, which are paramount in modern public health research and practice. It demonstrates an understanding that, while historical methods laid the groundwork, current ethical and legal standards must guide all epidemiological endeavors. An incorrect approach that focuses solely on historical methodologies without considering current U.S. privacy laws would represent a significant ethical and regulatory failure. For instance, relying on historical data collection methods that did not incorporate robust de-identification protocols or informed consent procedures would violate HIPAA and the Common Rule, 45 CFR Part 46, which govern the protection of human subjects in research. Such an approach would risk unauthorized disclosure of sensitive health information and undermine public trust in epidemiological research. Another incorrect approach might involve applying principles from other jurisdictions or historical periods that lack the stringent ethical oversight and legal protections now standard in the U.S. This would fail to meet the ACE Fellowship exam's implicit requirement to operate within the U.S. regulatory framework. The professional decision-making process for similar situations should involve a critical assessment of the historical context of epidemiological methods, followed by a rigorous evaluation of how these methods align with current U.S. federal and state regulations concerning data privacy, research ethics, and public health reporting. Epidemiologists must actively seek to understand and apply contemporary legal and ethical standards, ensuring that historical knowledge informs, but does not dictate, current practice in a manner that compromises patient rights or regulatory compliance. Question 3. Comparative studies suggest that exposure to a novel environmental pollutant is associated with an increased risk of a specific respiratory illness. However, several factors, including socioeconomic status and pre-existing lung conditions, are known to be associated with both exposure to this pollutant and the incidence of the illness. A research team is tasked with determining the independent effect of the pollutant on the respiratory illness. Which of the following analytical approaches would best address the potential for confounding in this study, adhering to the principles of rigorous epidemiological analysis? Option A. Report the crude association between the environmental pollutant and the respiratory illness without considering other related factors. Option B. Exclude individuals with pre-existing lung conditions from the analysis to simplify the assessment of the pollutant's effect. Option C. Conduct a multivariable regression analysis that includes the environmental pollutant as the primary exposure of interest and simultaneously adjusts for socioeconomic status and pre-existing lung conditions. Option D. Stratify the analysis by socioeconomic status, and then, in a separate analysis, stratify by pre-existing lung conditions, reporting the results of each stratification independently. The correct answer is C. Conduct a multivariable regression analysis that includes the environmental pollutant as the primary exposure of interest and simultaneously adjusts for socioeconomic status and pre-existing lung conditions. Explanation: scenario analysis. This scenario presents a common challenge in epidemiological research, identifying a true association between an exposure and an outcome while accounting for potential confounding factors. The professional challenge lies in selecting the most appropriate multivariable analytical strategy to isolate the effect of the exposure of interest, ensuring that observed associations are not distorted by other variables that are related to both the exposure and the outcome. Failure to adequately control for confounding can lead to erroneous conclusions about disease etiology, risk factors, and the effectiveness of interventions, which has significant implication for public health policy and practice. The American College of Epidemiology ACE Fellowship exam emphasizes rigorous analytical methods and the ethical responsibility to produce valid and reliable scientific evidence. Correct approach analysis. The correct approach involves using multivariable regression analysis to simultaneously adjust for the effects of identified confounders. This method allows epidemiologists to estimate the association between the exposure and the outcome, while holding the confounders constant at specific levels. This is best professional practice because it directly addresses the definition of confounding by isolating the exposure-outcome relationship from the influence of other variables. Regulatory frameworks and ethical guidelines for epidemiological research, as implicitly understood within the ACE context, mandate that researchers employ methods that minimize bias and maximize the validity of their findings. By controlling for confounders, the analysis moves closer to establishing a causal inference, which is a cornerstone of public health research and policy development. This approach aligns with the ACE's commitment to evidence-based public health and the responsible conduct of research. Incorrect approach is analysis. One incorrect approach would be to simply present the unadjusted, crude, association between the exposure and the outcome. This fails to acknowledge or address the potential for confounding, violating the ethical obligation to conduct thorough and unbiased research. Regulatory guidelines implicitly require that researchers account for known or suspected sources of bias, including confounding. Another incorrect approach would be to stratify the analysis by each potential confounder individually and report separate effect estimates without a formal method to combine or adjust for them simultaneously. While stratification is a valid technique for controlling confounding, presenting multiple stratified analyses without a unified multivariable model can be cumbersome and may not fully account for complex interactions or the combined effect of multiple confounders. This approach lacks the precision and efficiency of multivariable modeling. A third incorrect approach would be to exclude potential confounders from the analysis without a strong theoretical or empirical justification. This is ethically problematic, as it risks introducing bias and misrepresenting the true relationship between the exposure and the outcome, fails to meet the standard of scientific rigor expected in epidemiological research, and could lead to flawed public health recommendations. Professional reasoning. Professionals faced with this scenario should first identify potential confounders based on existing literature and theoretical knowledge. This involves understanding the relationships between the exposure, the outcome, and the potential confounders. Next, they should select an appropriate multivariable analytical technique, such as logistic regression or Cox proportional hazards regression, depending on the nature of the outcome variable. The model should include the exposure of interest and all identified confounders. The interpretation of the adjusted effect estimate should then be carefully considered in the context of the study's limitations and the broader body of evidence. This systematic approach ensures that the research is conducted ethically, adheres to scientific standards, and produces reliable results that can inform public health decisions. Question 4. Assessment of the data management techniques employed by an epidemiological research team studying a rare disease outbreak, where data is collected from multiple clinical sites using varying electronic health record systems and manual data entry forms. The team is under pressure to provide preliminary findings to public health officials within a tight deadline. Which of the following approaches best ensures data integrity and facilitates accurate analysis while adhering to ethical research practices? Option A. Collect data directly from the source systems and proceed with analysis, assuming that minor discrepancies will average out over a large sample size. Option B. Develop a comprehensive data dictionary defining all variables, their expected formats and coding schemes. Implement rigorous data cleaning protocols to identify and address outliers, inconsistencies, and missing values before analysis. Store cleaned and coded data in a secure, well-documented database. Option C. Create a unique, ad hoc coding system for each new data file received, documenting the coding decisions only in personal notes. Option D. Store all raw data in its original format in a shared network drive, relying on individual analysts to interpret and clean data as needed during their analysis. The correct answer is B. Develop a comprehensive data dictionary defining all variables, their expected formats and coding schemes. Implement rigorous data cleaning protocols to identify and address outliers, inconsistencies, and missing values before analysis. Store cleaned and coded data in a secure, well-documented database. Explanation. Scenario analysis. This scenario presents a common challenge in epidemiological research, ensuring the integrity and usability of data collected from multiple sources with varying formats and potential for error. The professional challenge lies in balancing the need for timely data analysis with the imperative of maintaining data quality, which directly impacts the validity of research findings and subsequent public health recommendations. The epidemiologist must exercise careful judgment to select appropriate data management techniques that are both efficient and compliant with ethical standards and potential regulatory requirements for data handling and research. Correct approach analysis. Implementing a standardized data dictionary and employing rigorous data cleaning protocols, including checks for outliers, inconsistencies, and missing values, represents best professional practice. This approach ensures that the data is accurate, complete, and interpretable, forming a reliable foundation for analysis. The use of a data dictionary promotes consistency in coding and variable definitions across the dataset, which is crucial for reproducibility and collaboration. This aligns with ethical principles of scientific integrity and the responsible conduct of research, ensuring that conclusions drawn are based on sound data. While specific U.S. regulations for research data management are broad, principles of data integrity are universally applied and are implicitly required by bodies like the National Institutes of Health, (NIH), for funded research, emphasizing accuracy and transparency. Incorrect approaches analysis. Collecting data without a standardized data dictionary and proceeding directly to analysis introduces a high risk of misinterpretation and errors due to inconsistent variable definitions and coding schemes. This failure to establish a clear data structure violates the principle of data integrity and can lead to flawed conclusions, undermining the credibility of the research. Ethically, this is a failure of due diligence in data management. Storing raw, unclean data in its original format without any validation or transformation makes it susceptible to errors and difficult to analyze systematically. This approach neglects the fundamental steps of data cleaning and coding, which are essential for ensuring data quality. It increases the likelihood of introducing systematic biases or errors into the analysis, which is professionally unacceptable and ethically questionable due to the potential for misleading public health insights. Developing a custom coding system for each new dataset without documentation or a central repository leads to a fragmented and unmanageable data environment. This lack of standardization makes it exceedingly difficult to integrate data from different sources or for other researchers to understand and utilize the data in the future. It represents a significant failure in data governance and reproducibility, hindering scientific progress and potentially violating principles of data sharing and transparency if applicable. Professional reasoning. Professionals should approach data management by first establishing a clear data governance framework, including a comprehensive data dictionary. This should be followed by systematic data cleaning and validation processes before any analytical procedures are undertaken. The choice of storage should prioritize security, accessibility, and long-term integrity. Decision-making should be guided by principles of scientific rigor, ethical conduct, and a commitment to producing reliable and valid research outcomes. When in doubt about specific regulatory nuances, consulting institutional review boards, or data management experts is a prudent step. Question 5. When evaluating the potential risk of a novel environmental exposure on a specific chronic disease outcome in a defined population, which study design approach would be most appropriate for a comprehensive risk assessment, considering the need to establish temporality and minimize confounding? Option A. A prospective cohort study, carefully selecting participants based on exposure status and following them over time to ascertain disease incidence. Option B. A cross-sectional study, assessing both exposure and disease status at a single point in time to estimate prevalence. Option C. A case control study, identifying individuals with the disease and comparing their past exposure history to that of individuals without the disease. Option D. A randomized controlled trial, assigning participants to different levels of the environmental exposure. The correct answer is A. A prospective cohort study, carefully selecting participants based on exposure status and following them over time to ascertain disease incidence. Explanation: this scenario is professionally challenging because it requires an epidemiologist to select the most appropriate study design for a risk assessment, balancing the need for robust evidence with practical constraints. The American College of Epidemiology ACE Fellowship exam emphasizes rigorous methodological understanding within the context of public health practice. Therefore, choosing a design that minimizes bias and allows for causal inference, while being feasible, is paramount. The correct approach represents best professional practice because it aligns with the fundamental principles of epidemiological study design and risk assessment as taught and expected within the ACE framework, prioritizes designs that can establish temporality and minimize confounding, which are critical for accurately assessing risk. This approach reflects a deep understanding of how different study designs contribute to the hierarchy of evidence and the ability to draw valid conclusions about exposure-disease relationships. An incorrect approach that relies solely on readily available data without considering the inherent biases of the source would be professionally unacceptable. This failure stems from a lack of critical appraisal of data quality and suitability for the intended purpose, potentially leading to inaccurate risk assessments and misguided public health interventions. Another incorrect approach, such as selecting a design that cannot establish temporality between exposure and outcome, would also be a significant failure. This would violate the core principles of causal inference, as it would be impossible to determine if the exposure preceded the disease, rendering the risk assessment invalid. Furthermore, using a design that is highly susceptible to selection bias without implementing appropriate mitigation strategies would be a failure to adhere to methodological rigor, undermining the credibility of the findings. Professionals should approach such situations by first clearly defining the research question and the specific risk being assessed. They should then systematically evaluate the strengths and weaknesses of various study designs in relation to the research question, considering factors like feasibility, cost, ethical implications, and the existing body of literature. A critical appraisal of available data sources and potential biases is essential. The decision-making process should involve a reasoned selection of the design that offers the best balance of methodological rigor and practical applicability to generate reliable evidence for risk assessment. Question 6. The monitoring system demonstrates a sharp increase in the number of new symptomatic cases of a respiratory illness reported in the past 2 weeks, alongside a stable number of individuals currently experiencing the illness and a slight rise in disease-related deaths. Which interpretation best reflects the current epidemiological situation and informs appropriate public health response? Option A. The data indicates a widespread and persistent epidemic, as evidenced by the high number of current cases, and the increase in deaths signifies a critical failure in public health interventions. Option B. The data suggests a rapid increase in new infections, indicating a potential outbreak requiring immediate containment efforts, while the stable prevalence suggests existing cases are resolving or not being newly diagnosed at a high rate. And the rise in deaths warrants investigation into case severity and treatment efficacy. Option C. The data primarily reflects a surge in reporting of mild symptoms, with little impact on the overall disease burden or mortality, suggesting that current surveillance methods are overly sensitive. Option D. The data highlights a decline in new infections, as the number of new symptomatic cases is lower than the total number of individuals currently experiencing the illness, and the rise in deaths is likely due to unrelated factors. The correct answer is B. The data suggests a rapid increase in new infections, indicating a potential outbreak requiring immediate containment efforts, while the stable prevalence suggests existing cases are resolving or not being newly diagnosed at a high rate, and the rise in deaths warrants investigation into case severity and treatment efficacy. Explanation: the monitoring system demonstrates a significant increase in reported cases of a specific infectious disease within a defined geographic area. This scenario is professionally challenging because it requires epidemiologists to accurately interpret and communicate key epidemiological measures to inform public health interventions and policy decisions. The urgency of an outbreak necessitates swift and precise action, making the correct application of incidence, prevalence, mortality, and morbidity data paramount. The correct approach involves a nuanced understanding of how each measure contributes to the overall picture of the disease burden and its impact. Incidence, representing new cases over a period, is crucial for understanding the rate of spread and the effectiveness of control measures. Prevalence, reflecting the total number of existing cases at a point in time, is vital for assessing the overall burden on the healthcare system and for long-term planning. Mortality data, indicating deaths attributable to the disease, highlights its severity and lethality. Morbidity data, encompassing the extent of illness and disability, provides a broader perspective on the disease's impact on population health and quality of life. A comprehensive analysis that integrates these measures, considering their specific definitions and applications, is essential for evidence-based public health action. This aligns with the ethical imperative of public health professionals to provide accurate and timely information to protect and improve population health, as guided by professional standards and regulatory frameworks governing public health surveillance and reporting. An incorrect approach would be to solely focus on one measure without considering the others. For instance, relying only on incidence might overestimate the immediate strain on resources if the disease has a low case fatality rate and long recovery period, or underestimate the long-term impact if prevalence remains high due to chronic cases. Conversely, focusing only on prevalence without considering incidence could lead to underestimating the ongoing transmission and the need for immediate control measures. Misinterpreting mortality as a direct indicator of disease spread, without accounting for delays in reporting or the impact of treatment, would also be a significant failure. Similarly, conflating morbidity with incidence or prevalence without clearly defining the scope of illness being measured, e.g., acute symptoms vs. long-term disability, would lead to flawed conclusions. These misinterpretations represent regulatory and ethical failures by not adhering to the established scientific definitions and applications of epidemiological measures, potentially leading to misallocation of resources, ineffective interventions, and compromised public trust. Professional decision-making in such situations requires a systematic process. First, clearly define the epidemiological question being addressed. Second, identify the most appropriate measures to answer that question, considering their definitions and limitations. Third, collect and analyze the relevant data accurately. Fourth, interpret the findings in the context of the disease, population, and available interventions. And finally, communicate the results clearly and concisely to stakeholders, emphasizing the strengths and limitations of the data and the implications for public health action. Question 7. Cost-benefit analysis shows that a significant portion of the public health budget is allocated to a chronic disease prevention program. To optimize resource allocation and ensure program effectiveness, an epidemiologist is tasked with evaluating the program's impact and identifying key modifiable risk factors. The epidemiologist is considering different observational study designs to inform future policy decisions. Which observational study design would be most appropriate for establishing the incidence of the disease and assessing the temporal relationship between potential risk factors and disease development, thereby providing the strongest evidence for the program's preventative strategy. Option A. A case control study, identifying individuals with the disease and comparing their past exposures to those without the disease. Option B. A cohort study, following a defined population over time to measure disease incidence and identify risk factors. Option C. A cross-sectional study, assessing disease prevalence and potential risk factors at a single point in time. Option D. a meta-analysis of existing randomized controlled trials, synthesizing findings from multiple intervention studies. The correct answer is B, a cohort study, following a defined population over time to measure disease incidence and identify risk factors. Explanation: this scenario presents a common challenge in public health epidemiology: resource allocation for disease prevention programs based on observational data. The difficulty lies in selecting the most appropriate study design to inform policy decisions when faced with limited budgets and the need for robust evidence. The core of the challenge is to balance the scientific rigor of different observational study designs with their practical feasibility and the specific questions being asked. The correct approach, which involves prioritizing a cohort study for assessing the long-term incidence of a disease and its associated risk factors, represents best professional practice because it aligns with the principles of establishing causality and understanding disease progression. Cohort studies, by following a defined group over time, can establish temporal relationships between exposure and outcome, a crucial element for inferring causality. This design is particularly valuable when investigating chronic diseases or outcomes with long latency periods, allowing for the calculation of incidence rates and relative risks, which are essential for informing cost-benefit analyses of preventative interventions. The ethical imperative is to base public health policy on the strongest available evidence, minimizing the risk of ineffective or harmful interventions. An incorrect approach would be to solely rely on a cross-sectional study for this purpose. While cross-sectional studies are efficient for estimating prevalence and identifying potential associations at a single point in time, they cannot establish temporality. This makes it difficult to determine whether an exposure preceded an outcome, thus limiting their utility in causal inference and the justification of preventative programs. Ethically, this approach risks misinterpreting associations as causal, leading to misdirected resources and potentially ineffective public health interventions. Another incorrect approach would be to favor a case-control study when the primary goal is to understand the incidence of a disease and its risk factors prospectively. Case-control studies are retrospective and start with the outcome cases and controls, making them prone to recall bias and selection bias. While useful for rare diseases or when a long follow-up period is impractical, they are less ideal for establishing incidence and temporal relationships compared to cohort studies. Relying on this design for broad prevention program justification could lead to flawed conclusions about risk factors and their impact on disease incidence, thus failing to meet the ethical standard of evidence-based decision-making. Professional decision-making in such situations requires a systematic evaluation of the research question, the available resources, and the strengths and limitations of different observational study designs. Epidemiologists must consider the specific public health objective, the nature of the disease or outcome of interest, and the desired level of evidence for policy recommendations. This involves understanding the hierarchy of evidence, where well-designed cohort studies generally provide stronger evidence for causality than cross-sectional or case-control studies for certain types of research questions. Question 8. Upon reviewing the preliminary results of a large prospective cohort study investigating the association between a specific environmental exposure and the incidence of a chronic disease, an epidemiologist is tasked with selecting the most appropriate statistical method for analyzing the primary outcome. The study design accounts for potential confounders through careful matching and stratification. The epidemiologist considers several statistical approaches to quantify the risk associated with the exposure. Which of the following approaches best reflects a commitment to rigorous statistical methodology and transparent reporting, as expected by the American College of Epidemiology? Option A. Employing a multivariable regression model that appropriately accounts for the matched nature of the cohort and the distribution of the outcome variable, while clearly reporting the adjusted effect estimates and their confidence intervals. Option B. Utilizing a complex machine learning algorithm for predictive modeling without a clear pre-specified hypothesis or a detailed explanation of the algorithm's decision-making process. Option C. Presenting only the statistically significant findings from exploratory analyses, while omitting non-significant results and analyses that did not support the initial hypothesis. Option D. Conducting a series of unadjusted chi-squared tests for each potential exposure disease association to identify any statistically significant relationships. The correct answer is A. employing a multivariable regression model that appropriately accounts for the matched nature of the cohort and the distribution of the outcome variable, while clearly reporting the adjusted effect estimates and their confidence intervals. Explanation. Scenario analysis. This scenario presents a common challenge in epidemiological research where the validity of statistical findings is paramount, especially when communicating results to stakeholders who may not have deep statistical expertise. The epidemiologist must balance the need for accurate statistical representation with the potential for misinterpretation of complex methods. The professional challenge lies in selecting a statistical approach that is both robust and interpretable, ensuring that the conclusions drawn are sound and ethically communicated, adhering to the principles of scientific integrity and transparency expected within the American College of Epidemiology (ACE) framework. Correct approach analysis. The correct approach involves selecting a statistical method that directly addresses the research question while being transparent about its assumptions and limitations. This aligns with the ACE's emphasis on rigorous methodology and ethical dissemination of findings, using a method that is well established for the specific study design e.g., a generalized linear model for a cohort study with a binary outcome, and clearly reporting effect estimates with confidence intervals provides a statistically sound and interpretable result. This approach upholds scientific integrity by ensuring that the conclusions are supported by appropriate statistical inference and that potential biases are acknowledged. Incorrect approaches analysis. One incorrect approach would be to oversimplify the statistical analysis to the point of obscuring important nuances or introducing bias. For instance, using a simple chi-squared test for a complex longitudinal study with potential confounders would fail to account for the study design and would likely yield misleading results, violating the ACE's commitment to methodological rigor. Another incorrect approach would be to employ a highly complex or novel statistical technique without sufficient justification or clear explanation of its application and interpretation. This could lead to a lack of transparency and make it difficult for peers or stakeholders to critically evaluate the findings, potentially undermining the credibility of the research and violating ethical principles of clear communication. A third incorrect approach might involve selectively reporting only the statistically significant findings, while omitting non-significant results or those that contradict the primary hypothesis. This practice is a form of data manipulation and directly contravenes ethical guidelines for scientific reporting, as it presents a biased and incomplete picture of the evidence. Professional reasoning. Professionals should approach statistical method selection by first clearly defining the research question and study design. They should then consider established statistical methods appropriate for that design and outcome. Transparency regarding assumptions, limitations, and the rationale for method selection is crucial. When communicating findings, the focus should be on clear interpretation of effect estimates and their uncertainty, avoiding jargon where possible or providing clear explanations. Peer review and consultation with statistical experts are valuable steps in ensuring methodological soundness and ethical reporting. Question 9. During the evaluation of a sudden increase in gastrointestinal illness among attendees at a large outdoor music festival, what is the most appropriate epidemiological approach to assess transmission, identify the source, and implement effective control measures? Option A. Focus solely on providing symptomatic relief and advice to affected individuals, deferring any formal epidemiological investigation until after the festival concludes and attendance numbers have significantly decreased. Option B. Prioritize obtaining complete laboratory confirmation for all reported cases before initiating any public health interventions or further epidemiological investigation to ensure the highest level of scientific certainty. Option C. Initiate immediate case finding through active surveillance, conduct interviews to gather detailed symptom and exposure histories, collect relevant environmental and biological samples for laboratory analysis, and implement targeted public health interventions based on initial findings while continuing to refine the epidemiological understanding of the outbreak. Option D. Rely primarily on informal reports from festival organizers and anecdotal accounts from attendees to guide public health recommendations and interventions, without conducting systematic data collection or analysis. The correct answer is C. Initiate immediate case finding through active surveillance, Conduct interviews to gather detailed symptom and exposure histories. Collect relevant environmental and biological samples for laboratory analysis. And implement targeted public health interventions based on initial findings, while continuing to refine the epidemiological understanding of the outbreak. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the rapid spread of an infectious disease within a defined community, necessitating swift and accurate epidemiological investigation. The challenge lies in balancing the urgency of outbreak control with the need for rigorous data collection and analysis, while adhering to established public health principles and ethical considerations. The epidemiologist must make critical decisions under pressure, impacting public health and individual liberties. Correct approach analysis. The correct approach involves a systematic and multifaceted investigation that prioritizes immediate containment measures while simultaneously gathering comprehensive data to understand transmission dynamics. This aligns with the core principles of infectious disease epidemiology and public health practice, emphasizing a proactive and evidence-based response. Specifically, it involves identifying cases, characterizing the outbreak through descriptive epidemiology, hypothesizing transmission routes, and implementing control measures based on scientific understanding. This approach is ethically sound as it aims to protect the community's health while respecting individual rights through appropriate communication and data privacy. Regulatory frameworks for public health emergencies, such as those guiding the Centers for Disease Control and Prevention, CDC, in the U.S., mandate such systematic investigations and interventions. Incorrect approach is analysis, an approach that solely focuses on immediate symptom management without a thorough epidemiological investigation fails to address the root cause of the outbreak and prevent future occurrences. This is a regulatory and ethical failure because it neglects the fundamental responsibility of public health to understand and control disease spread, potentially leading to prolonged outbreaks and increased morbidity and mortality. An approach that delays intervention until all laboratory confirmations are complete, while scientifically ideal in some contexts, is a critical failure in an acute outbreak setting. Public health regulations and ethical guidelines emphasize the need for timely action based on the best available evidence, even if preliminary. Delaying action can lead to exponential spread, overwhelming healthcare systems, and causing preventable harm, violating the principle of beneficence. An approach that relies solely on anecdotal evidence and community hearsay without systematic data collection and analysis is professionally unacceptable. This violates established epidemiological methodologies and can lead to misdirected interventions, wasted resources, and a failure to identify the true source and modes of transmission. Ethically, it risks making decisions that are not grounded in evidence, potentially harming individuals or the community. Professional reasoning. Professionals should employ a decision-making framework that integrates rapid assessment, evidence-based intervention, and continuous evaluation. This involves 1. Activating incident command structures for coordinated response. 2. Conducting rapid case finding and initial descriptive epidemiology. 3. Formulating and testing hypotheses regarding transmission. 4. Implementing targeted control measures based on the most likely transmission routes. 5. Continuously monitoring the outbreak and adapting strategies as new data emerge. 6. Ensuring clear and transparent communication with the public and stakeholders. This systematic process, guided by public health laws and ethical principles, ensures an effective and responsible response to infectious disease outbreaks. Question 10. The risk matrix shows a moderate likelihood of participant distress and potential for social stigma if sensitive questions regarding substance use and mental health history are included in a community-wide health survey designed to inform local public health resource allocation. The survey is being conducted by a nonprofit public health organization. The epidemiologist leading the survey is considering how to proceed with the questionnaire design and implementation. Option A. Collect the sensitive data without explicit mention of its sensitive nature in the consent form, and then share the aggregated, but not fully anonymized, data with local government agencies for planning purposes. Option B. Exclude the sensitive questions entirely to avoid any potential for participant distress or stigma, even though this data is crucial for accurately assessing community needs for mental health and substance use services. Option C. Include the sensitive questions. Clearly explain in the informed consent process the nature of these questions, the potential risks of distress and stigma, and the measures being taken to protect participant confidentiality and data security, including robust anonymization techniques. Option D. Include the sensitive questions, but omit specific details about the potential risks of distress and stigma in the informed consent document to avoid discouraging participation. The correct answer is C. Include the sensitive questions. Clearly explain in the informed consent process the nature of these questions, the potential risks of distress and stigma, and the measures being taken to protect participant confidentiality and data security, including robust anonymization techniques. Explanation. This scenario presents a professional challenge due to the inherent tension between the need to gather comprehensive data for a critical public health survey and the ethical obligation to protect participant privacy and prevent potential harm. The epidemiologist must navigate the complexities of survey design and implementation while adhering to the ethical principles and regulatory frameworks governing research involving human subjects, specifically within the context of the American College of Epidemiology, ACE, Fellowship Exams Implied U.S. Regulatory Framework. Careful judgment is required to balance scientific rigor with participant well-being and informed consent. The correct approach represents best professional practice because it prioritizes participant autonomy and data security. By clearly outlining the potential risks and benefits, obtaining explicit informed consent, and implementing robust data anonymization techniques, the epidemiologist upholds the principles of respect for persons, beneficence, and justice, as enshrined in ethical guidelines and regulations such as the Common Rule, 45 CFR Part 46, which governs federally funded research in the U.S. This approach ensures that participants are fully aware of their involvement and that their data is handled responsibly, minimizing the risk of re-identification and subsequent harm. An incorrect approach that involves omitting the sensitive questions due to fear of participant refusal fails to collect essential data, compromising the survey's scientific validity and its potential to inform public health interventions. This is an ethical failure as it prioritizes convenience over the pursuit of knowledge that could benefit the community. Another incorrect approach, which involves collecting the sensitive data without explicitly informing participants of its sensitive nature or the specific risks associated with its collection and potential re-identification, violates the principle of informed consent and the ethical duty to disclose material information. This can lead to participants feeling deceived and can erode public trust in research. Finally, an approach that involves sharing the collected sensitive data with external agencies without explicit consent or a clear legal basis, even if anonymized, represents a significant breach of privacy and trust, potentially violating data protection regulations and ethical principles of confidentiality. Professional reasoning in such situations requires a systematic approach. First, identify the core ethical and regulatory principles at play. Second, assess the potential risks and benefits of different survey design and implementation strategies. Third, consult relevant ethical guidelines and regulations, e.g., Common Rule, Institutional Review Board protocols. Fourth, consider the impact of each decision on participant autonomy, privacy, and beneficence. Finally, choose the approach that maximizes the scientific value of the research while minimizing harm and upholding the highest ethical standards. Question 11. Consider a scenario where an emerging chronic disease cluster is identified in a specific geographic region. A public health agency is tasked with developing immediate recommendations to mitigate potential risk factors and promote protective factors within the affected population. The lead epidemiologist is presented with preliminary, but not yet fully validated, data suggesting a strong association between a specific environmental exposure and the disease. The epidemiologist also has access to established research on known protective factors for similar chronic conditions. What is the most appropriate course of action for the epidemiologist to recommend to the agency, balancing the urgency of the situation with the need for scientific rigor and ethical considerations? Option A. Prioritize the dissemination of information regarding the suspected environmental exposure as a confirmed risk factor, urging immediate avoidance, and deferring any discussion of protective factors until the risk factor is definitively established. Option B. Issue broad public health advisements to avoid all environmental exposures, without specific identification of the suspected factor, and focus solely on promoting general healthy lifestyle choices until definitive data is available. Option C. Recommend a public awareness campaign solely focused on the known protective factors for chronic diseases, as the preliminary data on the environmental exposure is not yet sufficiently robust to warrant public concern or action. Option D. Recommend immediate, targeted public health messaging focusing on the suspected environmental exposure as a primary risk factor, while simultaneously initiating a comprehensive review of existing literature on both risk and protective factors for this and similar diseases, and planning for further data validation. The correct answer is D. Recommend immediate, targeted public health messaging focusing on the suspected environmental exposure as a primary risk factor, while simultaneously initiating a comprehensive review of existing literature on both risk and protective factors for this and similar diseases, and planning for further data validation. Explanation. This scenario presents a professional challenge due to the inherent tension between the need for rapid public health intervention and the ethical imperative to ensure that interventions are based on robust, evidence-based understanding of risk and protective factors. Epidemiologists, particularly those in leadership roles within public health agencies, must navigate the complexities of translating scientific findings into actionable policy while adhering to established ethical guidelines and regulatory frameworks. The pressure to act quickly in the face of a potential chronic disease epidemic can lead to premature or poorly supported recommendations, potentially causing undue public alarm or misallocating resources. The correct approach, which involves a thorough review of existing literature, consultation with diverse stakeholders, and a commitment to transparent data interpretation, represents best professional practice. This aligns with the core principles of public health ethics and the regulatory expectations for evidence-based decision-making. Specifically, it reflects the commitment to scientific integrity and the responsible dissemination of public health information, as often mandated by public health statutes and professional codes of conduct that emphasize accuracy and thoroughness. This approach ensures that interventions are targeted, effective, and minimize unintended consequences, thereby upholding public trust and optimizing resource utilization. An incorrect approach that prioritizes immediate, albeit unverified, action over rigorous analysis would represent a significant regulatory and ethical failure. Such an approach could violate principles of scientific integrity by promoting unsubstantiated claims, potentially leading to public health misdirection and harm. Ethically, it would fail to uphold the duty of beneficence and non-maleficence by risking ineffective or harmful interventions. From a regulatory standpoint, it could contravene guidelines that require public health recommendations to be grounded in sound scientific evidence and subject to peer review and validation processes. Another incorrect approach that relies solely on anecdotal evidence or the opinions of a select few, without broader scientific validation, would also be professionally unacceptable. This disregards the established methodologies of epidemiological research and the importance of generalizability and statistical rigor. Ethically, it undermines the principle of justice by potentially favoring certain groups or perspectives over others, and it fails to provide a sound basis for public policy. Regulatory frameworks typically mandate the use of validated data and methods for public health interventions. Finally, an approach that dismisses potential protective factors due to a focus solely on identifying novel risk factors would be a flawed strategy. This demonstrates a lack of comprehensive understanding of the multifactorial nature of chronic diseases and the importance of both mitigating risks and enhancing protective elements. Ethically, it limits the scope of potential interventions and may overlook opportunities for promoting health and well-being. Regulatory bodies often encourage a holistic approach to disease prevention and health promotion, which includes understanding and leveraging protective factors. Professional decision-making process in such situations should involve a systematic evaluation of the available evidence, a clear understanding of the potential benefits and harms of different interventions, and a commitment to transparency and stakeholder engagement. This process should be guided by established epidemiological principles, ethical frameworks, and relevant regulatory requirements, ensuring that decisions are both scientifically sound and ethically defensible. Question 12. The review process indicates that an epidemiologist is leading a project to analyze trends in a rare infectious disease using data collected from multiple healthcare providers across several states. The data includes patient demographics, diagnostic information, and treatment outcomes. To facilitate collaboration with researchers at a national institute, the epidemiologist is considering how to share the data. The primary ethical and regulatory considerations revolve around protecting patient privacy while enabling robust scientific inquiry. Which of the following approaches best navigates these ethical and regulatory considerations under U.S. federal law and established epidemiological ethics? Option A. Provide the National Institute with direct access to the electronic health record systems of the participating healthcare providers, allowing them to extract any data they deem necessary for their research. Option B. De-identify the data according to HIPAA safe harbor or expert determination methods. Obtain a data use agreement, DUA, with the National Institute outlining specific limitations on data use and re-identification, and ensure the National Institute has appropriate data security protocols in place. Option C. Share the raw, identifiable patient data with the National Institute, assuming that researchers at such an institution will handle it responsibly and that the public health benefit outweighs potential privacy risks. Option D. Anonymize the data by removing all direct and indirect identifiers, even if this significantly reduces the analytical utility of the dataset for studying the rare disease's specific risk factors and treatment effectiveness. The correct answer is B. De-identify the data according to HIPAA safe harbor or expert determination methods. Obtain a data use agreement, DUA, with the National Institute outlining specific limitations on data use and re-identification, and ensure the National Institute has appropriate data security protocols in place. Explanation. The review process indicates a scenario where an epidemiologist is tasked with managing sensitive health data collected for a public health surveillance program. The challenge lies in balancing the need for robust data analysis to inform public health interventions with the ethical and legal obligations to protect individual privacy and ensure data security. This requires careful consideration of data anonymization, consent, and access control, all within the framework of U.S. federal regulations governing health information. The correct approach emphasizes de-identification of data to the greatest extent possible while retaining analytical utility, obtaining informed consent for data use, and implementing strict access controls. This aligns with the principles of the Health Insurance Portability and Accountability Act, HIPAA, privacy rule, which permits the use and disclosure of de-identified health information for public health purposes without individual authorization, provided specific de-identification standards are met. It also reflects ethical guidelines for epidemiological research that prioritize participant privacy and data integrity. An incorrect approach that involves sharing raw, identifiable data with external researchers without explicit, informed consent violates HIPAA privacy rule and the ethical principle of confidentiality. This could lead to breaches of privacy, potential discrimination, and erosion of public trust in public health initiatives. Another incorrect approach, such as retaining identifiable data indefinitely without a clear research or public health justification, and without robust security measures, poses significant risks of unauthorized access and misuse, contravening data security mandates and ethical best practices. Finally, an approach that prioritizes data accessibility over privacy protection by making data broadly available without adequate de-identification or consent fails to uphold the fundamental rights of individuals whose data is being collected and managed. Professional decision-making in such situations requires a systematic approach. First, identify all applicable regulations, e.g., HIPAA, state privacy laws. Second, assess the nature of the data and the potential risks associated with its collection, storage, and dissemination. Third, determine the minimum necessary data required for the intended public health purpose. Fourth, implement appropriate de-identification techniques and robust security measures. Fifth, ensure that informed consent processes are clear, comprehensive, and ethically sound. Finally, consult with institutional review boards or ethics committees when uncertainties arise. Question 13. Which approach would be most appropriate for an epidemiologist tasked with investigating a potential link between a specific industrial chemical in the air and the subsequent development of a rare respiratory disease in a nearby community, considering that the exposure may have occurred years prior to diagnosis and the disease is uncommon. Option A. A randomized controlled trial, assigning individuals to different levels of exposure to the chemical. Option B. A case control study, comparing past exposure levels in individuals with the respiratory disease to those without. Option C. A descriptive case series, documenting the characteristics of individuals who have developed the respiratory disease. Option D. A cross-sectional study, assessing current exposure levels and current disease status in the community. The correct answer is B. A case control study, comparing past exposure levels in individuals with the respiratory disease to those without. Explanation. This scenario presents a common challenge in public health epidemiology, determining the most appropriate study design to investigate a potential association between an environmental exposure and a health outcome, given resource constraints and ethical considerations. The professional challenge lies in balancing the scientific rigor required for valid causal inference with the practical limitations of data collection and the ethical imperative to protect human subjects. Careful judgment is required to select a design that maximizes the likelihood of detecting a true association while minimizing bias and confounding, and adhering to established ethical principles for research involving human populations. The correct approach, utilizing a case control study, represents best professional practice because it is an efficient analytical epidemiological design for investigating rare diseases or outcomes with long latency periods. It allows for the examination of multiple potential exposures retrospectively, making it suitable for investigating environmental factors where the exposure may have occurred long before the outcome is diagnosed. This design, when properly executed with careful selection of controls and accurate assessment of exposure, can provide valuable insights into potential risk factors. The regulatory framework for epidemiological research, as guided by principles of scientific integrity and ethical conduct, supports the use of such designs when they are the most feasible and appropriate for answering the research question, provided that appropriate measures are taken to minimize bias and confounding. An incorrect approach would be to immediately propose a cross-sectional study. This design, while descriptive and useful for assessing prevalence, is inherently limited in establishing temporal relationships between exposure and outcome. It cannot determine whether the exposure preceded the disease, making it prone to reverse causality bias. Ethically and scientifically, it would be a failure to propose a design that cannot adequately address the research question and could lead to erroneous conclusions about causality. Another incorrect approach would be to suggest an experimental study, such as a randomized controlled trial, RCT, for investigating the effect of an environmental exposure on a health outcome. Such an approach is generally not feasible or ethical in this context. It is typically impossible to ethically randomize individuals to different levels of environmental exposure, especially if those exposures are potentially harmful. Proposing an experimental design in this scenario would demonstrate a fundamental misunderstanding of the ethical and practical limitations of different epidemiological study types, and would be a significant regulatory and ethical failure. Finally, an incorrect approach would be to solely rely on a descriptive study, like a case series or ecological study, without moving towards analytical methods. While descriptive studies can identify patterns and generate hypotheses, they are insufficient for investigating associations between specific exposures and outcomes. Proposing only a descriptive study would fail to meet the scientific rigor expected for investigating potential causal relationships and would not adequately address the public health concern. The professional decision-making process for similar situations should involve a systematic evaluation of the research question, the characteristics of the exposure and outcome, available resources, and ethical considerations. This includes 1. Clearly defining the research question and hypotheses. 2. Considering the strengths and limitations of various epidemiological designs, descriptive, analytical, experimental, in relation to the research question. 3. Assessing the feasibility and ethical implications of each design. 4. Selecting the design that offers the best balance of scientific validity, practicality, and ethical acceptability. And 5. Planning for appropriate methods to minimize bias and confounding within the chosen design. Question 14. Strategic planning requires an epidemiologist to assess a community's response to a novel, potentially infectious agent. A local journalist reports anecdotal evidence from several residents claiming unusual symptoms and a cluster of illnesses. The epidemiologist's initial review of available public health surveillance data shows no statistically significant increase in reported illnesses that would typically trigger an alert for this type of agent. However, the journalist's report has generated significant public concern and calls for immediate public health action. What is the most appropriate epidemiological approach in this situation? Option A. Immediately implement broad public health interventions, such as widespread testing and isolation protocols, based on the anecdotal reports to preemptively address the perceived threat, even without confirmed epidemiological data. Option B. Initiate a rapid, targeted investigation to systematically collect data on reported symptoms and potential exposures, while simultaneously communicating the ongoing investigation and the current lack of definitive evidence to the public and stakeholders. Option C. Advise the journalist to cease reporting on the issue until a formal epidemiological investigation can be completed, to avoid causing undue public alarm and to maintain the integrity of the investigative process. Option D. Publicly reassure the community that current surveillance data does not indicate an outbreak, advising residents to remain calm and await further official reports, while deferring any active investigation until more concrete evidence emerges. The correct answer is B. Initiate a rapid, targeted investigation to systematically collect data on reported symptoms and potential exposures, while simultaneously communicating the ongoing investigation and the current lack of definitive evidence to the public and stakeholders. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for public health action with the ethical imperative to ensure the accuracy and integrity of epidemiological data. The epidemiologist must consider the potential consequences of both premature action and delayed investigation, all within the framework of established public health principles and the scope of epidemiological practice. Careful judgment is required to navigate the uncertainty and potential for harm. The correct approach represents best professional practice because it adheres to the core definition and scope of epidemiology, which emphasizes systematic investigation, data collection, analysis, and interpretation to understand disease patterns and inform public health interventions. This approach prioritizes scientific rigor, ensuring that any public health recommendations are based on sound evidence, thereby protecting the public from potentially ineffective or harmful interventions. It aligns with the ethical obligation to conduct thorough and unbiased research, a cornerstone of public health practice. An incorrect approach that focuses solely on immediate public outcry without sufficient data fails to uphold the scientific integrity of epidemiology. This could lead to misallocation of resources, unnecessary public alarm, and potentially ineffective interventions, violating the principle of evidence-based decision-making. Another incorrect approach that dismisses the initial report due to lack of immediate corroboration risks delaying crucial public health action, potentially allowing a disease outbreak to spread unchecked, which is a failure to protect the public's health. A third incorrect approach that prioritizes personal convenience or avoids potential controversy over rigorous investigation undermines the fundamental responsibility of an epidemiologist to investigate health threats systematically and objectively. Professionals should employ a decision-making framework that begins with acknowledging the reported health concern and initiating a systematic investigation. This involves defining the problem, gathering preliminary data, assessing the plausibility of the report, and then proceeding with appropriate epidemiological methods, e.g., case finding, descriptive studies, hypothesis generation. Throughout the process, communication with relevant stakeholders should be transparent and based on the evolving evidence. The decision to implement interventions should be guided by the strength of the epidemiological evidence and a risk-benefit analysis. Question 15. Stakeholder feedback indicates a need to enhance the statistical analysis capabilities for a large-scale public health surveillance project. The project involves analyzing complex longitudinal data with the goal of identifying emerging disease trends and informing policy decisions. The team is considering adopting a new statistical software application. Which of the following approaches best aligns with principles of scientific rigor, transparency, and reproducibility in epidemiological research? Option A. Continue using SPSS as it is familiar to most team members, ensuring quick turnaround times for analyses, even if it means less transparency in the underlying analytical steps for complex modeling. Option B. Choose Stata primarily based on its user-friendly interface and the team's existing familiarity, prioritizing ease of use over the potential for more advanced or transparent analytical methods. Option C. Adopt SAS, given its long-standing reputation in statistical analysis, without extensively evaluating if its specific functionalities are superior to other available options for this particular project's needs. Option D. Select R due to its open-source nature, extensive community support, and vast array of specialized packages suitable for advanced epidemiological modeling, ensuring full transparency and reproducibility of analytical workflows. The correct answer is D. Select R due to its open-source nature, extensive community support, and vast array of specialized packages suitable for advanced epidemiological modeling, ensuring full transparency and reproducibility of analytical workflows. Explanation. This scenario presents a professional challenge due to the potential for misinterpretation and misuse of statistical software outputs, which can have significant implications for public health policy and research integrity. The core of the challenge lies in balancing the need for efficient data analysis with the ethical obligation to ensure that the chosen software and its application are appropriate for the intended purpose and do not introduce bias or lead to erroneous conclusions. Careful judgment is required to select the most suitable software and to implement it in a manner that upholds scientific rigor and transparency. The correct approach represents best professional practice because it prioritizes the scientific validity and reproducibility of the epidemiological analysis. Utilizing R, a free and open-source statistical programming language, allows for greater transparency in the analytical process. The ability to share scripts and code ensures that analyses can be scrutinized, replicated, and validated by other researchers. This aligns with fundamental principles of scientific integrity and the ethical imperative to conduct research in a transparent and accountable manner. Furthermore, R's extensive package ecosystem supports a wide range of advanced statistical methods, making it highly adaptable to complex epidemiological research designs. An incorrect approach that involves exclusively relying on SPSS for complex modeling, without considering its limitations or the availability of more specialized tools, fails to meet the standards of best practice. While SPSS is user-friendly, its proprietary nature can limit transparency, and for highly specialized or cutting-edge epidemiological analyses, its capabilities might be less robust or flexible compared to R or SAS. This could lead to an incomplete or potentially biased analysis, undermining the credibility of the research findings. Another incorrect approach, using SAS without a clear justification for its selection over other options, might also be problematic. While SAS is a powerful and widely used statistical software, its cost can be a barrier, and its proprietary nature also raises transparency concerns. If the choice of SAS is not driven by specific analytical needs that cannot be met by open-source alternatives, or if it leads to a less reproducible analysis due to limited sharing of code, it could be considered suboptimal. Finally, an approach that prioritizes ease of use and familiarity with a particular software, e.g., Stata, over the specific analytical requirements of the epidemiological study is professionally unsound. While familiarity can contribute to efficiency, it should not supersede the need for the most appropriate and rigorous analytical tools. If Stata's capabilities are insufficient for the intended analysis, or if its use prevents transparent sharing of the analytical process, it would represent a failure to uphold scientific standards. The professional decision-making process for similar situations should involve a systematic evaluation of the research question, the nature of the data, the required statistical methods, and the principles of transparency and reproducibility. This includes assessing the strengths and limitations of various statistical software packages, considering factors such as cost, licensing, community support, and the availability of specific analytical functions. The ultimate decision should be guided by the pursuit of the most scientifically sound, reproducible, and ethically defensible analytical approach. Question 16. The investigation demonstrates a need to assess the prevalence of a rare occupational exposure among a highly specific subpopulation of workers. While national health surveys provide some general occupational data, they lack the granularity and specificity required to accurately capture this particular exposure within the defined worker group. The research team is considering two main strategies: adapting existing, but less specific, secondary datasets, or designing and implementing a targeted primary data collection effort. Which of the following approaches best aligns with the principles of rigorous epidemiological research and ethical data collection for this scenario? Option A. Utilize the most comprehensive available secondary datasets, acknowledging their limitations in specificity, and attempt to infer the prevalence of the rare exposure through statistical modeling and imputation techniques. Option B. Combine data from multiple disparate secondary sources without a clear protocol for harmonization or validation, assuming that the aggregation of information will compensate for the lack of specificity in individual datasets. Option C. Rely on anecdotal evidence and expert opinion from individuals familiar with the occupational group to estimate the prevalence of the exposure, as primary data collection would be too time-consuming and costly. Option D. Prioritize the development and implementation of a primary data collection instrument, specifically designed to measure the rare occupational exposure within the target subpopulation, ensuring appropriate ethical review and informed consent procedures are followed. The correct answer is D. Prioritize the development and implementation of a primary data collection instrument specifically designed to measure the rare occupational exposure within the target subpopulation, ensuring appropriate ethical review and informed consent procedures are followed. Explanation: the investigation demonstrates a common challenge in public health research, balancing the need for timely, relevant data with the ethical and practical considerations of data acquisition. Epidemiologists often face situations where existing secondary data sources are insufficient or outdated for a specific research question, necessitating the collection of primary data. However, primary data collection is resource-intensive and carries significant ethical responsibilities, particularly concerning participant privacy and informed consent. The professional challenge lies in judiciously selecting the most appropriate data source, considering its validity, reliability, and the ethical implications of its use, all within the framework of established epidemiological principles and any applicable regulatory guidelines. The correct approach represents best professional practice by prioritizing the collection of primary data when existing secondary sources are demonstrably inadequate for addressing the specific research question with the required level of detail and accuracy. This aligns with the core principles of rigorous epidemiological inquiry, which demand that research questions be answered with the most appropriate and reliable data available. The American College of Epidemiology, ACE, fellowship exam emphasizes the importance of sound methodological choices that uphold scientific integrity. Collecting primary data, when justified, allows for tailored data collection instruments and protocols, ensuring that the data directly addresses the research objectives and is collected under controlled conditions, thereby enhancing its validity and reliability for the specific study. This proactive approach ensures the highest quality of evidence for public health decision-making. An incorrect approach would be to rely solely on readily available secondary data, even if it is known to be incomplete or potentially biased, for the specific research question. This failure to critically evaluate the suitability of secondary data for the intended purpose represents a methodological weakness. Ethically, it could lead to flawed conclusions that misinform public health interventions, potentially causing harm. Another incorrect approach would be to proceed with primary data collection without a robust ethical review and informed consent process. This would violate fundamental ethical principles governing research involving human subjects and could lead to legal and professional repercussions, undermining public trust in epidemiological research. Furthermore, an incorrect approach might involve misrepresenting the limitations of the chosen data source, either primary or secondary, in the dissemination of findings. This lack of transparency is a serious ethical breach and compromises the scientific integrity of the work. Professional decision-making in such scenarios requires a systematic process. First, clearly define the research question and the specific data needed to answer it. Second, conduct a thorough assessment of existing secondary data sources, evaluating their relevance, completeness, accuracy, and potential biases in relation to the research question. Third, if secondary data is insufficient, carefully plan the collection of primary data, ensuring it adheres to ethical guidelines, including obtaining necessary Institutional Review Board (IRB) approval and informed consent from participants. Fourth, Document the rationale for choosing either primary or secondary data, or a combination thereof, and clearly articulate any limitations of the data used in the final dissemination of findings. This structured approach ensures that methodological rigor and ethical considerations are paramount. Question 17. Risk assessment procedures indicate a rising prevalence of multi-drug-resistant organisms in a regional healthcare system, leading to increased patient morbidity and mortality. As an epidemiologist advising public health authorities, which of the following approaches best addresses the multifaceted public health implications of antimicrobial resistance in this context? Option A. Impose a blanket, system-wide restriction on the use of all broad-spectrum antibiotics for a defined period, irrespective of specific resistance patterns or clinical necessity, to rapidly reduce overall antibiotic consumption. Option B. Mandate immediate and severe penalties for all healthcare providers found to have prescribed antibiotics inappropriately, without providing additional resources or support for alternative treatment strategies. Option C. Develop and implement a comprehensive, multisectoral strategy that includes enhanced surveillance for AMR, promotion of antimicrobial stewardship programs across human and animal health sectors, investment in diagnostics, and targeted public education campaigns, while engaging with healthcare providers, policymakers, and the public to foster collaborative solutions. Option D. Focus exclusively on large-scale public awareness campaigns highlighting the dangers of AMR, assuming that increased public knowledge will naturally lead to changes in prescribing and consumption behaviors without further programmatic or regulatory interventions. The correct answer is C. Develop and implement a comprehensive, multisectoral strategy that includes enhanced surveillance for AMR, promotion of antimicrobial stewardship programs across human and animal health sectors, investment in diagnostics, and targeted public education campaigns, while engaging with healthcare providers, policymakers, and the public to foster collaborative solutions. Explanation: this scenario is professionally challenging because it requires balancing the immediate public health imperative to control antimicrobial resistance, AMR, with the economic and operational realities faced by different stakeholders. The American College of Epidemiology, ACE Fellowship exam emphasizes the application of epidemiological principles to public health policy and practice, requiring fellows to consider diverse perspectives and evidence-based interventions. The correct approach represents best professional practice because it prioritizes a multi-stakeholder, evidence-based strategy for AMR containment. This aligns with the core principles of public health epidemiology, which advocate for collaborative efforts, data-driven decision-making, and consideration of social determinants of health and economic impacts. Specifically, it reflects the understanding that effective AMR control requires coordinated action across human health, animal health, and environmental sectors. One health approach, supported by robust surveillance and research, and tailored interventions that consider local contexts and resource availability. This approach is ethically sound, promoting the greatest good for the greatest number while acknowledging the responsibilities of various actors. An incorrect approach that focuses solely on punitive measures against healthcare providers without addressing systemic issues or providing support fails to acknowledge the complex drivers of AMR and the practical challenges faced by frontline clinicians. This approach is ethically problematic as it places undue blame without offering solutions, and could lead to unintended consequences like reduced reporting or access to care. It also fails to adhere to the principles of public health intervention, which emphasize education, capacity building, and collaborative problem solving. Another incorrect approach that prioritizes immediate, broad-spectrum antibiotic restrictions without considering the specific epidemiological data on resistance patterns or the clinical necessity for certain treatments would be a failure of evidence-based practice. This could lead to suboptimal patient outcomes, increased morbidity and mortality, and potentially drive the emergence of resistance to alternative agents. It neglects the nuanced understanding of AMR epidemiology required for targeted interventions. A third incorrect approach that relies solely on public awareness campaigns without implementing concrete policy changes or investing in infrastructure for surveillance and stewardship would be insufficient. While public awareness is important, it is not a standalone solution for a complex public health crisis like AMR. This approach fails to address the systemic factors that contribute to resistance and neglects the need for regulatory and programmatic interventions. The professional decision-making process for similar situations should involve a systematic assessment of the AMR problem, including epidemiological data on resistance trends, transmission pathways, and risk factors. This should be followed by an inclusive stakeholder engagement process to understand different perspectives and constraints. Interventions should be designed based on the best available evidence, considering feasibility, cost-effectiveness, and potential unintended consequences. Continuous monitoring and evaluation are crucial to adapt strategies as the AMR landscape evolves. Question 18. Performance analysis shows that a novel public health intervention designed to reduce the incidence of a chronic disease has shown promising results in preliminary laboratory studies. To determine its effectiveness and feasibility in a real-world setting, an epidemiologist is considering different study designs. The intervention targets a broad demographic across multiple communities, and there are concerns about potential unintended consequences and the need for community buy-in. The epidemiologist must select the most appropriate approach to rigorously evaluate the intervention while upholding ethical standards and ensuring the generation of actionable evidence for public health policy. Option A. Implement a community trial with minimal oversight and no pre-testing of the intervention to expedite the evaluation process and gather data quickly. Option B. Conduct a pilot randomized controlled trial RCT within a representative subpopulation to assess efficacy and safety, followed by a community trial with community engagement and adaptive strategies based on pilot findings. Option C. Immediately launch a large-scale community trial across all target communities without prior controlled testing to maximize reach and impact. Option D. Rely solely on observational data from existing public health programs that have implemented similar, but not identical, interventions to infer the effectiveness of the new intervention. Correct answer is B. Conduct a pilot randomized controlled trial RCT within a representative subpopulation to assess efficacy and safety, followed by a community trial with community engagement and adaptive strategies based on pilot findings. Explanation. This scenario presents a common challenge in public health research, balancing the ethical imperative to protect participants with the scientific need for robust evidence to inform intervention. The professional challenge lies in navigating the complexities of implementing a community trial while ensuring that the intervention is both effective and ethically sound, particularly when dealing with potentially vulnerable populations or sensitive health issues. Careful judgment is required to select the most appropriate study design and implementation strategy that maximizes scientific validity while minimizing potential harm and respecting community autonomy. The correct approach represents best professional practice because it prioritizes a phased, evidence-based implementation strategy that aligns with the principles of ethical research and public health action. By starting with a pilot randomized controlled trial, RCT, within a defined subpopulation, researchers can rigorously assess the intervention's efficacy and safety in a controlled environment. This allows for the collection of high-quality data to inform decisions about broader implementation. Subsequently, a community trial can be designed based on these findings, incorporating community engagement and adaptive strategies to address contextual factors and ensure equitable reach. This phased approach adheres to the ethical principles of beneficence, maximizing benefits, and non-maleficence, minimizing harm, by ensuring the intervention is well understood and safe before widespread deployment. It also respects the principles of justice and autonomy by involving communities in the planning and implementation process, particularly in the community trial phase. This aligns with the ethical guidelines for epidemiological research that emphasize rigorous methodology, participant protection, and community benefit. An incorrect approach that proposes immediately launching a large-scale community trial without prior controlled testing fails to adequately assess the intervention's efficacy and potential harms. This could lead to the widespread dissemination of an ineffective or even harmful intervention, violating the principle of beneficence and potentially causing harm to a large population, thus failing the principle of non-maleficence. Such an approach also neglects the scientific rigor required for evidence-based public health, potentially wasting resources and delaying the adoption of truly effective interventions. Another incorrect approach that suggests abandoning the community trial in favor of solely relying on observational data from existing programs is ethically problematic. While observational data can provide valuable insights, it is often subject to significant confounding factors and biases, making it difficult to establish causality. This could lead to policy decisions based on weak evidence, potentially failing to address the public health issue effectively, and thus not fulfilling the duty of beneficence. Furthermore, it bypasses the opportunity to generate stronger evidence through a controlled trial, which could lead to more impactful interventions. A third incorrect approach that advocates for a community trial with minimal oversight and no pretesting of the intervention is ethically and scientifically unsound. This approach risks exposing communities to an unproven intervention without adequate safeguards, potentially leading to adverse outcomes and a breach of trust. It fails to uphold the principles of scientific integrity and participant protection, which are fundamental to ethical research and public health practice. The professional decision-making process for similar situations should involve a systematic evaluation of the research question, the available evidence, the target population, and ethical considerations. This includes 1. Defining the research objectives and the specific public health problem to be addressed. 2. Reviewing existing literature and evidence to identify potential interventions and their known efficacy and safety. 3. Considering the most appropriate study design, e.g., RCT field trial, community trial, that can best answer the research question while adhering to ethical principles. 4. Engaging with stakeholders, including community members and relevant ethical review boards, throughout the research process. 5. Developing a detailed protocol that outlines participant recruitment, data collection, intervention delivery, monitoring, and data analysis, with a strong emphasis on participant safety and data integrity. 6. Planning for phased implementation, starting with smaller-scale studies if necessary, to refine the intervention and study design before larger-scale deployment. Question 19. Compliance Review shows a recent fellowship candidate's presentation on the history of epidemiology focused heavily on the descriptive observations of John Snow and the early miasma theory, with minimal discussion of the shift towards germ theory, the development of randomized controlled trials in public health, or the ethical considerations that emerged with larger-scale population studies. Which of the following approaches to assessing the candidate's understanding of epidemiological history best reflects the standards expected by the American College of Epidemiology? Option A. Prioritizing the candidate's knowledge of the statistical techniques employed in early epidemiological studies, even if they lack understanding of later theoretical developments. Option B. Focusing solely on the candidate's detailed recounting of early theories of disease causation, such as miasma, as these represent the initial attempts to understand epidemics. Option C. Evaluating the candidate's ability to articulate the foundational contributions of early observational studies, while also recognizing their limitations and the subsequent evolution of methodologies and ethical frameworks in epidemiology. Option D. Assessing the candidate's familiarity with the social and political contexts that influenced early epidemiological investigations, irrespective of their understanding of methodological advancements. The correct answer is C. Evaluating the candidate's ability to articulate the foundational contributions of early observational studies, while also recognizing their limitations and the subsequent evolution of methodologies and ethical frameworks in epidemiology. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the interpretation and application of historical epidemiological principles within a contemporary public health context. The challenge lies in discerning which foundational approaches to disease investigation remain relevant and ethically sound, versus those that have been superseded by advancements in methodology, understanding of disease etiology, and ethical considerations. Careful judgment is required to avoid perpetuating outdated or potentially harmful practices, while still acknowledging the historical contributions to the field. Correct approach analysis. The correct approach represents best professional practice because it demonstrates an understanding of the evolution of epidemiological thought and practice. It acknowledges that, while early epidemiological investigations laid crucial groundwork, subsequent scientific and ethical developments have refined our methodologies and responsibilities. Specifically, recognizing the shift from purely observational and often descriptive approaches to more nuanced, hypothesis-driven, and ethically sensitive research is paramount. This approach aligns with the core principles of the American College of Epidemiology, ACE, which emphasizes rigorous scientific inquiry, ethical conduct, and the application of epidemiological knowledge for the betterment of public health. It reflects a commitment to evidence-based practice and continuous learning within the discipline. Incorrect approaches analysis, an approach that solely emphasizes the descriptive methods of early epidemiology without acknowledging subsequent advancements, fails to meet contemporary standards of scientific rigor and ethical responsibility. This represents a failure to engage with the evolution of the field and could lead to incomplete or biased conclusions. Ethically, it might overlook the potential for harm or stigmatization that can arise from simplistic descriptive analyses without deeper causal investigation or consideration of social determinants. An approach that prioritizes intervention strategies based on anecdotal evidence or historical precedents without rigorous scientific validation demonstrates a disregard for the evidence-based principles that underpin modern epidemiology. This is a significant ethical failure, as it risks implementing ineffective or even harmful public health interventions. It also fails to adhere to the scientific method that is central to epidemiological practice. An approach that dismisses the contributions of early epidemiologists entirely overlooks the foundational knowledge and methodological innovations that pave the way for current practices. While not all historical methods are directly applicable today, understanding their context and limitations is crucial for a comprehensive grasp of the discipline's history and development. This represents a lack of intellectual humility and a failure to appreciate the cumulative nature of scientific progress. Professional reasoning. Professionals should approach such situations by first grounding themselves in the historical context of epidemiological inquiry. This involves understanding the key figures, landmark studies, and prevailing paradigms of different eras. Subsequently, they must critically evaluate these historical approaches against current scientific standards, ethical guidelines, and technological capabilities. The decision-making process should involve a comparative analysis, identifying what has been retained, what has been refined, and what has been discarded, and understanding the rationale behind these changes. This iterative process of historical appreciation and critical evaluation ensures that current practices are both scientifically sound and ethically defensible, aligning with the ACE's commitment to advancing public health through robust epidemiological science. Question 20. Process analysis reveals that an epidemiologist is designing a study to investigate the association between a novel environmental exposure and a rare disease. Due to significant budget and time constraints, the initial sample size calculation suggests a number of participants that is unattainable. The epidemiologist is considering several strategies to proceed. Which of the following represents the most appropriate and professionally responsible course of action? Option A. Conduct a thorough review of existing literature to identify the smallest plausible effect size that would still be considered clinically or epidemiologically significant, and recalculate the sample size. If the recalculated size remains infeasible, explore options such as broadening the inclusion criteria, extending the study duration, or collaborating with other research groups to increase the sample size, while transparently acknowledging the limitations of any chosen path. Option B. Inflate the expected effect size in the sample size calculation to a level that yields a feasible sample size, assuming that a larger effect is more likely to be detected. Option C. Proceed with the study using the initially calculated sample size, understanding that the power will be significantly reduced, but hoping that a statistically significant result might still emerge by chance. Option D. Adjust the alpha level to a more lenient value e.g. 0.10 to reduce the required sample size, without explicitly informing the study participants or the scientific community about this modification. The correct answer is A. Conduct a thorough review of existing literature to identify the smallest plausible effect size that would still be considered clinically or epidemiologically significant, and recalculate the sample size. If the recalculated size remains infeasible, explore options such as broadening the inclusion criteria, extending the study duration, or collaborating with other research groups to increase the sample size, while transparently acknowledging the limitations of any chosen path. Explanation. Scenario analysis. This scenario presents a common challenge in epidemiological research where resource constraints, time and budget, directly impact the ability to achieve adequate statistical power for a study. The epidemiologist must balance the scientific rigor required for a robust study with the practical limitations of real-world research. Failure to adequately address statistical power can lead to underpowered studies, resulting in a failure to detect true associations, wasted resources, and potentially misleading conclusions that could influence public health policy or clinical practice. The professional challenge lies in making informed decisions about study design and execution that maximize the likelihood of achieving meaningful results within these constraints, while adhering to ethical and regulatory standards for research. Correct approach analysis. The correct approach involves a thorough and iterative process of sample size determination that explicitly considers the desired statistical power, effect size, alpha level, and anticipated variability, all within the context of available resources. This aligns with best practices in epidemiological research design, which are implicitly supported by regulatory frameworks that emphasize the responsible conduct of research and the generation of reliable evidence. Specifically, the ethical imperative to avoid unnecessary participant exposure and resource expenditure necessitates a well-justified sample size. A power calculation that is transparent about assumptions and acknowledges limitations, even if it suggests a larger sample than feasible, is crucial. This allows for informed discussions about trade-offs, such as modifying the primary outcome, increasing the duration of the study, or seeking additional funding, rather than proceeding with a study doomed to be underpowered. This approach reflects a commitment to scientific integrity and the efficient use of research funds, which are core tenets of responsible epidemiological practice. Incorrect approaches analysis. One incorrect approach is to arbitrarily select a sample size based on convenience or historical precedent without a formal power calculation. This is professionally unacceptable because it bypasses a fundamental step in study design, leading to an unknown level of statistical power. This can result in a study that is either underpowered, failing to detect a true effect, or overpowered, wasting resources. Ethically, it can lead to the exposure of participants to research risks without a reasonable expectation of generating meaningful scientific knowledge. Another incorrect approach is to proceed with a study design that is known to be underpowered due to resource limitations, without any attempt to adjust the study parameters or acknowledge the limitations upfront. This is a failure of scientific rigor and can lead to the dissemination of inconclusive or misleading findings. Regulatory frameworks implicitly require that research be designed to yield valid results, and an intentionally underpowered study undermines this principle. A third incorrect approach is to inflate the expected effect size in the power calculation to achieve a feasible sample size, without strong justification. This is a form of scientific misconduct, as it manipulates assumptions to fit desired outcomes. It leads to an overestimation of the study's ability to detect an effect, and can result in false positive conclusions or a failure to detect a real but smaller effect. This violates the ethical obligation to report research findings accurately and transparently. Professional reasoning. Professionals should approach sample size determination as an integral part of the research design process. This involves 1. Clearly defining the primary research question and outcome. 2. Identifying the minimum clinically or epidemiologically meaningful effect size to detect. 3. Specifying the desired level of statistical power, typically 80% or 90%, and alpha level, typically 0.05. 4. Estimating variability based on prior literature or pilot data. 5. Performing a formal power calculation. 6. Assessing the feasibility of the calculated sample size within resource constraints. And 7. If infeasible, iteratively adjusting study parameters e.g. effect size, outcome definition, duration, or seeking additional resources, while transparently documenting all decisions and their rationale. This systematic approach ensures that the study is designed to maximize its scientific yield, while adhering to ethical and practical considerations.